Hello, my name is David Trimberger, and this is my second attempt at direct oral pediatric intubation. First thing that I want to do is gather up all of my materials, such as a laryngoscope with a couple different sets of blades set aside in case I need a bigger or smaller size. I want to make sure that I have an ET tube for pediatrics ranging about a 3.5 to a 4.5. I have a suction device, some form of padding, a BVM, and capnography, and then some form of securing device. After I've gathered up all my materials, I want to put on proper PPE. And then I'm going to come over and manually open up the airway. If I see any secretions or vomitus or blood, I will go ahead, insert my suction device, close, and then suction for no longer than 10 seconds, only on my way out. Then after I've done that, I'm going to, measure my OPA, go ahead and insert my OPA. Then I'm going to connect my BVM to oxygen, go ahead and put my patient on a high flow nasal cannula, and then I'm going to connect my patient to an SpO2 monitor, because my goal is I'm trying to attempt to pre-oxygenate them and get their SpO2 to 100% and allow them just to be oxygenated as best as I can. And I'll be ventilating them at a rate of 10 to 12 times a minute, assessing for adequate chest rise and fall, and trying to maintain their airway. After they have been pre-oxygenated, I will go ahead and begin my intubation setup. So I'm going to remove my OPA, remove the mask off of my BVM, attach my BVM to capnography, grab my ET tube, grab my laryngoscope, and then I'm going to lift up my patient, pad in between their scapula to try and get them into a more neutral sniffing position to allow for their trachea to be more inline. And I'm going to come over, displace the tongue, lift up, insert my tubing to the proper depth, inflate my cuff, remove my syringe, remove my stylet, connect my capnography to the monitor, and then I will go ahead and begin to start ventilating my patient at a rate of 10 to 12 times a minute. I'm also going to be assessing for signs of hypoxia as I'm going throughout my skill. Even though I have capnography on, I can see misting in the tube. I want to do a secondary confirmation, so I will go ahead and I will auscultate over both the lungs as well as the epigastrium to make sure that I'm properly ventilating my patient. Once I've been ventilating them for a little bit, I want to go ahead and secure my tubing. Okay. I'll secure my tubing, go back, ventilate my patient, continue to ventilate them, assessing for signs of hypoxia, gonna monitor their SpO2 as well as their capnography, and then notice for any change in patient condition en route to the hospital. Thank you.